Hi, good morning. Happy Friday, everyone. I am going to show you one of the modalities that we use for pain relief in our clinic. I have talked to you about the acoustic wave, which is one of my very favorites, but I also love the cold laser. So just to start, this is one of the units of a cold laser unit that we have. This one is considered a hands-free unit because technically we can lay it on and move it as necessary, or as needed, but it doesn't require us to hold it in place the entire time. And I'll show you the other one, which is not considered a hands-free unit. The other thing about this particular unit is it's digital and automatic. So we have control over the number of cycles, and it goes all the way up to 18 cycles at a time, which is about 9 minutes of cold laser therapy. So this is an excellent unit to have. This other one, also very effective, very good, but it requires a human being to hold the laser on the different points. So you can't just lay it on the point that you want. You would have to move it around as you need it to. So what is cold laser? What does it do? A lot of people ask, what's the difference between cold laser and hot laser? And cold laser is essentially exactly what it sounds like. It's not ablative. It's not used to cauterize or cut through tissue, anything like that. It is completely painless. Most people don't feel anything at all. I think it's 1% of the population may feel a tingling, but no pain whatsoever. It does penetrate through the soft tissue, and it controls inflammation. It reduces that inflammatory response. It also is an analgesic, so you can see why then it would be very beneficial for pain relief. In addition to that, it stimulates ATP production in the mitochondria. And that's important because those cells need energy for self-repair. And that's what the ATP does. Each session, it just depends on the severity of the condition and the pain. We might use, a couple cycles or a couple sets of those 18 cycles, or we may just need a couple of cycles. It really just depends. I'm trying to think of the other questions we typically get with this, and I can't think of any. But if you guys have some, if you want more information about it, I'm happy to answer your questions. Just let me know. And I know what I wanted to tell you. It does have a compounding effect. So most people will notice a difference after the first session. And I personally don't like to don't let my patients leave unless I've reduced their pain by 50% or half. If we're getting on into the hours, of course I won't keep them hostage, but I use the cold laser quite a bit for that. And the more you use it, the more sessions you have with it, the longer lasting the results are and the more permanent they become. So typically 6 to 12 sessions is just kind of the standard, but of course we can go less or more as needed. So that's all I can think to tell you guys. But again, like I said, if you have questions, let me know. Feel free to comment, give us a call, email us, and we'll be happy to answer those questions for you. Okay, have a great day, you guys.